And without further ado, because we have so much to cover, I'm going to put you across to our course tutor, Dr. William Davies. William Davies is a consultant psychologist and head of applied clinical psychology at the Association for Psychological Therapies. Courses written by him have been studied by well over 100,000 mental health professionals, meaning that his input will, at a conservative estimate, have influenced interventions with well over 1 million people. For more information, see Wikipedia. William Davies, psychologist. So over to you, Will, all yours.
Well, here we are. Welcome back, and welcome for the first time if he's not coming back. Just to reiterate the rationale for this hour that's turned into probably something less than 2 hours, I should think, but over 1 hour. The idea is straightforward, really, that I was looking at how many books there are about mental health. And you can buy any one of 4,500 at the moment if you go on Amazon, or you could buy all 4,500 if you wish. And it seems to me that that can't be right. We can't be that complicated that it needs 4,500 books to help us to lead a proper, rewarding life. So what I set myself the task of doing was to say, well, what is it then? And there's quite a lot of things, quite a lot of boxes to tick potentially, but we don't have to tick them all. And they're all very simple, really. So this, the hour or an hour and a half, or whatever it is to have a look at all of those and have a look at what we got. So I do reiterate what Amy said, though. When you have some good thought, do put it in the chat to everybody, because you get some great things there. Now, in the first hour, I was just trying to recollect, Amy, what we covered. We did biology, I beg your pardon, we did behavior. We didn't do biology, and we didn't do people, and we didn't do the environment.
I remember responding to distress.
Yeah, we did that.
Yep.
And I think we did mental activity as well, didn't we?
I think we did, yeah, I remember that slide, yes.
Okay, so let's, what should we do first? Biology, people, or the environment?
And we've got some nice people telling us exactly what we did do, and we didn't do untreatable problems either, apparently.
No, we didn't, no. That's only one slide. That's a good slide, but it's only one. So
okay.
Slap in chat, if you would, whichever you want to start with, biology, people, or the environment. And Amy will make a judgment. By the way, Amy is your spokesperson. You can't actually talk directly to everybody, but Amy is your spokesperson. You tell Amy what to say, and she says it frighteningly well.
We are getting a lot of biologies and peoples.
Biology and people. Okay, well, let's start with biology and go on with people. Here we are. Here's the magic screen. Biology is that one there. So there we go. Right. Well, biology used to be everything. There's two things about working with people's biology. It used to be everything. In other words, we didn't used to have mental health specialists before really the advent of Freud. Before that, we had friends and family and so forth. And we also had philosophers and thinkers, but we didn't really have mental health specialists. You've had serious mental problems, you went to see your physician. And they did very well, really, quite surprising. So it's good to see what comes under biology. The other thing about biology is this is very difficult to work with in terms of patients, because anything we talk about in biology, they've heard it before. They've seen it in magazines and so forth. They don't do it necessarily, but they have heard about it. So us telling them again, they're kind of immunized to it. They're not necessarily going to take much notice. So those are the two things that makes it kind of tricky or interesting to work with biological factors, but they are crucially important. I was talking to somebody this morning and they said, well, what are you talking about this afternoon? And I said, well, biology and people and so on. And they said, well, that's everything, isn't it? Biology and people, that is all there is, really. That's a very knowledgeable person replying. So let's have a look what there is under biology. First thing we have to talk about in biology is illnesses, because some illnesses mimic mental health conditions. For example, hypothyroidism mimics depression, and hyperthyroidism mimics anxiety. A friend of mine went down to the doctor, again, a very knowledgeable, clued up friend, went along to the GP wanting antidepressants because they were depressed. So it seemed like a reasonable thing to go and get some antidepressants. And the GP sort of respected this person because they're very knowledgeable and so on. But they did say to them, well, okay, but let me just do a thyroid test before I prescribe those. And lo and behold, the thyroid test came back, and the person was extremely hypothyroid. So first step is to correct that condition as far as possible. So whatever illnesses we have, it's a really good idea to sort them out as far as possibly can do. Not everything can be sorted, but on the other hand, have a go at sorting them out before we do anything else biological. So if we're working with people, then to really check what illnesses they may or may not have, very important to get things checked out before we go launching onto anything more sophisticated or time-consuming. Next thing is diet. Now, this is very kind of controversial because there's no doubt about it, there is massive evidence about how diet affects people's mood. If you go onto Google Scholar and search for diet and mood, you'll find lots of good stuff. And so it's incontrovertible that diet does affect people's mood. And yet, if you talk about diet too much, you're viewed as a little bit of a, not a crank necessarily, but a little bit sort of hung up on diet and so forth. So you have to steer a sort of narrow line there, careful course of action. One of the things that happens is that many people really do have food sensitivities that do affect their health and well-being. Have irritable bowel syndrome and sensitive to particular foods and so on. Any of these kind of things is bound to affect the person's mood. There's one survey, for example, that looked at people with IBS, and they said, on average, they were asked, how many years would you give up of your life for the remaining years to be lived without IBS? Average response was they'd give up 25% of their lives, they'd give up 1/4 of their lives if they could be promised that the remaining 3/4 would be lived without the IBS symptoms. So those kind of digestive disorders are very important to people and their well-being and their mental well-being in particular. And it's interesting if you think, well, where do these sensitivities come from? Because sensitivities are different from allergies. Allergies are very readily fatal sometimes. Sensitivities are, the point about a sensitivity is that we are sensitive if we have too much of a particular foodstuff. So we can cope with a certain amount of it, but too much, and we become sensitive, and it has various effects and so on. So what people do very often is they find what they're sensitive to and they cut it out completely. And I'm not sure that's a good idea. In fact, I'm pretty darn sure it's a really bad idea, because what happens is it puts a bigger load on the remaining foods that you're eating, and gradually, one by one, you can get a sensitivity to those because you're basically eating too much of them, and we get sensitive to it. And if you look, there's some fascinating research being done and on how we've eaten over the millennia, over the thousands of years that we've been around. What have we done eating-wise? And originally, of course, we were hunter-gatherers, and much more gatherer than hunter, to be honest. So we ate what the heck we could find, and that was very diverse. We had a very good food diversity, and people didn't get sensitive to things because they weren't eating enough of one thing to become sensitive to it. Then we got into farming, and of course, then there was plentiful supply of wheat or whatever it was that people were farming at the time. And that's when sensitivities, well, our best guess is that's when our sensitivities started, when we could easily eat too much of one particular foodstuff. So if we're trying to address sensitivities of all sorts, then the thing to do is to go for diversity. Don't try and eradicate everything you might be sensitive to, I'd suggest. I'd go for diversity and have plenty of different things. But we're going to look at this again in a minute. When we come to sleep, what's next? Sleep. When we come to sleep, we'll have a look at this again because there's a master plan. We have a look at it. Okay, sleep. This is the other big one. 3 or 4 years ago, everyone was talking about diet. Currently, everyone's talking about sleep. And both of them, the fact is, it's like brakes and steering on a car. They're both essential and they're both really important. It's not the case that one's more important than the other. And people talk about sleep hygiene. And that's good, but it's not, it's good, but it's not enough. So let's have a look at sleep hygiene first of all. Thing to do is to go to bed only when you're tired. That's a nice finding from CBT with insomnia, actually, that you need to go to bed when you're tired, but not necessarily before then. And it's good if you go to bed at the same kind of times and get up at the same kind of times. So you have a sort of routine and the body gets into a rhythm, a circadian rhythm, as they call it, and we tend to sleep easier that way. And that we use bed mainly for sleep, not for doing emails or reading or watching TV and computer games. I must admit, I think it's really good for emails and reading and watching TV. But there we are. You're not meant to do that according to the sleep hygiene factors. But the real thing, and this is the thing about CBT with insomnia and CBT for diet, is to keep a diary with real data on what you do and a measure of what you're interested in. So for instance, you might be interested in improving your sleep. You might be interested in improving IBS symptoms or whatever dietary symptoms. You might be interested in improving your mood, your mood, either anxiety, depression, or whatever it might be. So you keep a record of those things, perhaps at least once a day, probably 2 or 3 times a day. You measure how those things are doing. And then what happens is then you say, well, let's say today, I had a really good sleep last night and everything's going fine, really good mood, etc., etc. And if I went to see a therapist and I told them all that and said how wonderful today was, they would say, well, what did you do yesterday? I said, oh, well, don't know, it's probably just an ordinary day. Well, what did you eat yesterday? Oh, I can't really remember. What time did you go to bed? Oh, I'm not really sure. So what you do is you keep a really good diary, a really good log, like it's like Scott going to the North Pole, South Pole, and and keep a real log of what you do, what you eat, what you do, what time you go to bed, everything. So when you have a really good day, you can look back on what happened yesterday and say, well, why did I sleep so well last night? What was I doing yesterday that caused me to sleep so well last night? What was I eating yesterday that caused me to have such a settled system today? And what was I doing and eating and sleeping about that caused me to be in such a good mood today? And it's so simple. It's quite a lot of work, actually, but it's interesting to do. And it is very straightforward and simple. And it answers that question that no reasonable patient can ever answer. When you say to them, what did you do yesterday then, in detail, they really can't tell you. So that full diary like that is much more fuller than a standard CBT diary for mood and activity. It's a much more detailed thing than that, but you've got the idea, I think. Really is like gold dust. Can tell you, you work out all you want to work out. So just to finish off, you see, today you might say, yeah, slept really well. And you make a hypothesis. You look back on yesterday and you make a hypothesis as to what caused that. Or really good mood today. You look back on yesterday and what you're doing today, and you make a hypothesis as to what's caused that. Amy, I'm looking at you and thinking you want to say something.
Well, Barry has just messaged just to help you with your sleep, saying that blue light sensitivity disrupts normal release of chemicals that aid relaxation and sleep. You should be doing your emails in bed.
Oh, yes. Yeah, no, yes, no, I'm okay, thanks. But
Barry didn't actually say it was for your emails, but
all right, yeah, thanks for the concern. Thanks for the, but yeah.
And also we're still getting a lot, which is lovely, to all panelists, but if everyone wants people to see their messages, they do need to put all panelists and attendees.
Okay, lovely, thanks. So that's a really, really great thing that you keep a log. I like to think of it as a log. I think of Scott at the Antarctic. And yeah, really good. Here's the other one that people exert us to do, which is exercise. Now, Professor Dame Sally Davies was the Chief Medical Officer prior to the current one, who is Chris Whitting now, isn't it? But it was Dame Sally Davies. And she said this, she said, people are always asking for a magic medicine, a medicine that will improve them in all sorts of ways, not have any side effects, and be easily affordable. And she says there is such a medicine, and it's called exercise, which is interesting. It's a very striking way of expressing it. So that's stuck in my mind. But there again, I can remember a very eminent psychiatrist saying, all you need to do is to walk around the garden every day. That's all you need to do. It might be fine if you live at Chatsworth or something, but I think most of us would need a slightly larger garden than the average for that to be adequate. Now, it's very interesting, actually, the stuff on exercise, because we're exhorted constantly to exercise and to do more and more exercise and so on. And yet, it's a really difficult thing to research. And so the research on it is always open to challenge. The reason it's difficult to research is that what you really want to do is to take 1,000 people who don't exercise, or you take 1,000 people at random and ask them not to exercise for 5 years. And then to take another 1,000 people at random and ensure that they do exercise for the next 5 years and see what happens to them. That's what you'd like to do. No one's ever done that, and it's absolutely impossible to do. So we're left with very equivocal things, like people say, well, people who exercise tend to be much fitter than those who don't exercise. And we have no idea really which is chicken and which is egg. Perhaps fitter people tend to exercise more. Almost certainly they would do, wouldn't they? You know, if you're fit and full of energy and so on, you're probably going to take lots of exercise. But if you're not very fit anyway, you're just born not very fit and not very full of energy, you probably won't take much exercise. So your casual researcher comes along and says, look, the people who take lots of exercise, they're fitter than the ones who don't. But we really have no idea whether it's chicken, which is chicken and which is egg, which comes first. One thing does seem to be clear, though, and that is it's not a good idea to be sedentary, to sit all day looking at the computer screen or whatever it would be. To be sort of active, walking about and so on, that seems to be an eminently good idea. So, so there we are. Do say what you found in the chat. I have to say, when I exercise, it does me no good whatsoever, but I'm probably not allowed to say that, really.
Good job you didn't say that then.
Yes. I've included this one as a kind of curveball. It's irritants. Now, this is Edward Bullmore, is a psychiatrist. He's head of psychiatry at Cambridge University. If anybody else had talked about this, then I think they wouldn't have had any notice taken of him. But because it's him, quite rightly, we tend to take notice, I think. But it's interesting because he talks about irritants and he talks particularly about biological irritants and the effect on mental health. And he cites an example of it is from his own personal experience of he went to see the dentist and he had various work done on him. And of course, that caused a lot of kind of irritation to his system. You know, what happens if people stick drills in your mouth and do that kind of thing? It causes a lot of irritation to the system. And he said he went home in the evening time after that, and he said he was in a real proper depressed mood. Negative thoughts, all the things that are associated with depression, fully fledged, depressive episode. The only thing that happened was he'd been to the dentist. And so that's what interested him, and he started investigating this. And he found that a lot of people, for example, people with multiple sclerosis, they tend to be depressed. And of course, the traditional explanation is, well, why wouldn't you be? And if you had multiple sclerosis, why wouldn't you be depressed? It's common sense. But he had the hypothesis that there's maybe more than this, that whatever causes the irritation and distress biologically that causes MS also maybe causes distress in the mental health system, so depression and anxiety. And he investigated that, and he's written a book entirely about this. And it's very, very convincing, actually. This is one possible cause of depression. He's not trying to put every depressive incident down to these kind of causes, but he puts it down as one possible cause of depression. And do you know what he loves particularly in terms of irritants? Is the bugs that float around the mouth. So he says oral hygiene is really important. So if you have depressed patients and anxious patients, get them to take special care of their oral hygiene. Well, why not? It's a fairly easy thing to do compared to a lot of things we do. So that's a little bit of a curveball, but who knows? It may come out that this is exactly what we should have been doing for years. So.
Had some nice comments about exercise, and Heidi saying that there's quite a bit of research into the effects of green space on mental health.
Yes, yes.
And Barry suggesting that connecting with nature is key. So one idea is put plants in the home as well.
Oh, how lovely. Yeah, that's really interesting, actually. Sorry, who was it who said about the green space?
That was Heidi.
Yeah, that's really interesting, Heidi, because it's absolutely right that and green space exercise in green space seems to do people more good than exercise in a gym, for example. So it was obviously, the least we can say is there's a lot more to it than simple exercise.
Do you know the book title for the Edward Bullmore?
No. If
Jill's helpfully put, it's called The Inflamed Mind.
That's it. That's the one.
Thank you, Jill.
Very good. It's good teamwork here, isn't it?
And do you have any suggestions for people with chronic pain or slip discs or arthritis with regards to exercise?
Oh, be very careful, I would, because I think the best person to give you advice on that is actually a physio who looks at you specifically. I wouldn't be qualified to give blanket advice on that sort of thing, but I do know one or two physios who are absolutely have startling results for that sort of thing, what you can and can't do. Equally, it's a question of finding a good physio that suits you, I think.
Jill has also suggested mindfulness outside and practicing. And so I can't see the end of your name, but Kaylee swears by aquariums and fish tanks.
Yes.
Found it extremely helpful with pain distraction.
Oh, fantastic. Fantastic.
And Liz, I think it was you who was after the suggestions for people with chronic pain. There's some lovely ones in chat. They're all pouring in now.
Fantastic. Fantastic. Isn't that nice about the aquariums? Because that's a very specific thing. And I bet there's a whole load of people who would find that really, really helpful. And it's the kind of thing that if you keep a diary of what is helpful and what isn't, these things pop up. And you think, well, who on earth would ever have thought of aquariums? Well, it turns out that some people find that really good. This is the last one on biology, and that's mood-altering addictive substances, of which alcohol is way ahead of every other much more glamorous substance you can think of. Much more distress and so forth is caused by alcohol than anything else by a million miles. And it is a very interesting one because it is an addictive substance. And although we give words, we talk about alcoholics, you don't need special words for people who get addicted to alcohol. The substance itself is addictive. So it's an easy thing to become addicted to it. Now, and it's very seductive as well as addictive, because what happens is in the early years, you really enjoy drinking. It's not depressant at all. It's not at all depressant. It heightens your mood, and everyone says, don't be silly. It's a wonderful thing. Trouble is, you get accustomed to it. The effect diminishes. You have to drink more, and you do get addicted to it. And the only effect it has is as a depressant, typically, finally in the end. So that's a bit gloomy, but the good news is that if you can if that's the state that one of your patients is in, then the good news is the number one thing to do is to help them with that state, and to treat the alcohol dependency as early as you can, because it really is. If you don't do that, then you're just pushing a boulder uphill forever. It's just a constant depressing effect on the person. And I think, Amy, that is, well, let's just, there we are. There's the summary. Sort out illnesses, work on sleep if you need to, eat a healthy diet, take some exercise, don't be sedentary, remove biological irritants, and address addictions.
You love the ancient philosophers, don't you? Because Marcus told us that Hippocrates said that walking is man and woman's best medicine.
Oh, lovely.
Even before your lady, Hippocrates was done.
Yes, yes. Well, yes. If you look at treatments for PTSD, the EMDR, for example, that's when that was the initial thing that gave rise to that was people noticing what a soothing and helpful effect it was to have the rhythmic exercise of simply walking. So it wasn't so, in their case, it wasn't so much the actual exercise as the rhythm and so on. And they replicated that with rhythmically looking at a hand going to and fro. So yeah, but it was, and a lot of poets have written about how great walking is for your well-being. Yeah.
I'm afraid people are taking to alcohol during the pandemic. So they are enjoying their alcohol in chat.
Well, I must admit, I was feeling a little bit hypocritical as I was saying about it. So yeah, why not? Yeah. Okay, all done?
All done.
Okay.
There has been a lot of love for aquariums as well.
That's good. Right. Okay, best biology. Next one is people.
Yeah, a lot of people wanted people.
Great, great. Well, strictly speaking, of course, the slide isn't really people, but I thought that looked nice. So there we are. Turns out people is really important. Now, if you don't know the Harvard study, then you'll be fascinated by it. And you can spend many happy hours reading about it on the web. The Harvard study normally brings it up, or if that doesn't bring it up, put Grant and Gluck. That's G-L-U-E-C-K, pronounced Gluck. Grant and Gluck, the Harvard study. And this was absolutely fascinating. This started 75 years ago. And they had this great idea. They said, well, let's just follow all the people who are currently in Harvard, the Harvard undergrads, and measure just about everything. You know, like I was saying about measure just about everything for yourself, keep your diary, keep your log, like Captain Scott. Well, they did this for all the undergrads at Harvard, or a very large group of them, if not all of them. And they simply followed them, and they measured just about everything. Their weight, their blood pressure, their satisfaction with their marriage, how many friends they had, everything, the jobs they got, and they followed everything. And of course, they found that such and such a percentage committed suicide. One of them one of the ones they followed became president of the United States. Some became, had severe problems drinking. Some became very wealthy, and so on. And then they try to make sense of it. They try to say, well, what would have been predictors of what happens to the person later on? And they found some remarkable things. For example, if you wanted to know how long a person is going to live, and you could take some measurements at when the person is aged 50, you might as well measure their blood pressure perhaps at 50. So, well, you could measure how happy they are in their marriage. Would that be relevant to how long they might live? Turns out, yes. How happy they are in their marriage at age 50 is a much better predictor of how long they're going to live than their blood pressure. I think, well, that can't be right. But no, it absolutely is. So granting, look, the course has been going on for so long, 75 years. The study has had several directors because they die eventually. Every person who's the director of the study is a very senior person. And the current one is Robert Waldinger. And he says this: the clearest message that we get from this 75-year study is this: good relationships keep us happier and healthier. Brilliant study, and he talks very well about it. He's also on YouTube. You can look up Robert Waldinger, and you can find him talking about the Grant and Gluck study fascinatingly there. Wonderful thing. It is just a great thing. The only thing is, and this is a big but, I'm afraid, it's all men, no women. Has anyone any idea why that would be?
Just while everyone's thinking, Kim has popped in with we're feeling very cultured this afternoon. Sartre's quote, hell is other people, but without them we don't exist.
Yes, yes. L'enfer, c'est les autres. Yeah, that's, yeah. Hell is other people. Very good.
We've got some suggestions that there's only men in Harvard.
Absolutely spot on. 75 years ago, that was absolutely true. No longer is true, of course, and it's no longer, it's now men and women, of course. So, yeah, and it's men and women in the study now. So there we are. That's the Harvard study. Fascinating. Now, but you can have a lot of fun with the social network, especially if you do a diagram like this. Now, if you, it's a bit like a dartboard in a way, isn't it? Or a bullseye or something like that. Put yourself in the middle, then there's a kind of inner circle, and this person has their partner who's just in their inner circle, but their sister who is even closer. Then what's the next person? The next person is probably a colleague at work. Then a little bit further away maybe is the old school friend, and a bit further away still is their mother. And this was a real person. And so there you are. You might say, well, would be any sort of suggestions you might make to that person just on the basis of that? If they're plotting their social network like that, would you come up with any suggestions? Slap them in chat if you would, just on the basis of that simplest of diagrams. For me, I suppose, doesn't seem to be many people really. I'd have wanted a few more people on it maybe. And
I suggest that there's a lack of friends in the diagram. Rachel says, what can they do to move their partner closer?
Yeah.
And yet Lisa also wants to get the partner closer.
Yeah.
I'm a bit worried about the mother on the edge.
Yes, yes, yes. Yeah, fascinating. Gosh, people do type quickly, don't they? So, but anyway, that's quite good fun to plot your social network like that. But where it really becomes ever so fun is when you put numbers by these people. So you can have from +3 to -3, because you know your partner, you might not actually be getting on at all with your partner. They might be -3, but quite close to you, obviously, but might have a really bad effect on you. And so on. So what happens when you put numbers on these people? Well, that's what we did with this person. And this is what came out. The person who's closest to them is their sister, and that's -2. So it's a close relationship, but a close negative relationship. Close to them, but having a bad effect. Partner was, yeah, a bit further away and not really a strong effect. And really distressingly true, I thought, was the colleague at work who's -3 and quite close. So the sister at -2 and really close, colleague at -3 and quite close. It's no wonder the person has come for treatment, really. And a mother who's sort of distant and has a neutral effect, neither good nor bad. And the old school friend who has a +3 rating. But of course, I think you can be too cynical, but it's possible to wonder whether the old school friend is rated very positively because they don't see so much of them anymore. So that really, once you do that to your social network, to your diagram of your social network, you really do get some insights. If you do it for yourself, or you do it for your patients, then you really do straight away see some things you want to intervene with, either for yourself or your patient. And
Sophie's partner is zooming in and out the circle during lockdown.
In and out of the circle, yes, yeah. Well,
and sorry, what do the numbers represent?
Oh, +3 means a strong positive relationship. In other words, it's have a good effect on them, love seeing them, etc., etc. -3 is a strong negative relationship. So, disagreeing, arguing, causing trouble for each other, etc. So the closeness, the colleague is the obvious one that stands out a bit because they're pretty close and it's a strong negative relationship. Arguments, disagreements, etc. Sister, likewise, even closer, sees a lot of the sister, but it's a pretty negative relationship. So is a whole host of work you want to do with this person. Lovely. And whoever said, there's not many friends there, that's kind of the most salient point, and very often we miss the most obvious point. Very good. Okay. Now, I've put pets under this heading of people. So working with the people in the person's life, our life or the patient's life, is really, really important. But I have a friend who he got himself a dog, and that absolutely transformed his life. I do not exaggerate, it literally transformed his life. And he has a better relationship with his dog than he does with any of his friends. And and he takes the dog for a walk, so it's a bit like the green space exercise, and he bumps into people and has a routine social contact. On account of that, people talk to the dog, and he talks to their dog, and so on. And so it's interesting because I can't honestly think of good research evidence on pets, but there must be lots of good research evidence. But there's loads of anecdotal evidence, and it seems to me that evidence is evidence. And of course, when we're trying things with ourselves or with other people, the real evidence we want is what they call from our clinical practice. In other words, practice-based evidence, they call it. So you try something out with a person or with yourself and see what effect it has. And as long as you're measuring mood or whatever it is, then we can see which way we're going and are we heading in the right direction. And that is the most solid form of evidence I think we can have. So yes, and just a small story. I was seeing, I remember one young man I was seeing, he turned up all smart to the outpatient clinic, a lovely suit, very sort of, avant-garde type of chap, and he parked his Mercedes outside in the car park, and in he strides and so on. And he was a mixture of depressed and anxious. And I was doing a standard assessment with him and asking him about various things. And he said how his wife had left him early on in the year. And then it came to various traumas and so on. And I said, presumably the biggest event or the biggest trauma, if you like, that's happened to you recently is your wife leaving you. Oh, no. He said, no. He said, my cat died last year. And it's my stereotypes, I suppose, because he was sitting there in his posh suit and his Mercedes outside. I didn't have him down as a kind of cat lover. And I wondered whether he's pulling my leg. I wondered whether he's really saying, of course, that's the biggest thing that's happened to me. What do you think? My wife leaving me. Of course, that would be the biggest thing. But no, he's absolutely serious. His cat had died not 12 months previously. And he was still very, very shaken by that. And I'm sure there's lots of people who can, agree with that. I've got a good friend who is very sort of, what you might say, very level-headed and very concrete and so on. He's got 2 cats. One of them died. He said it took him 2 years to get over it in any shape or form. So there we are. People and pets, I think, go together.
Maureen's asked, on the previous diagram, I'm afraid everyone loves your previous diagram. Would it be helpful to rate your relationship with yourself?
Oh, gosh. Well, why not? I love data, and you could rate all sorts of things about yourself. I think that you could just say, yes, I have a very positive relationship with myself. I like myself very much. Or you could go into various details about how competent do you rate yourself. Would you say that generally you are competent in life? And self-efficacy, as they term it, self-efficacy, how competent you view yourself, that is a terrific predictor of all sorts of good things. And how hopeful are you? So you could rate yourself on all sorts of things, I guess, yes. But you could, I rather like the higher order strategies like you suggested there, just how much you like yourself, yeah.
And in your experience, do people rate their abusive relationships positively or negatively?
Oh, negatively. But most people, I find, are very straightforward, and abusive relationships are negative. And that's the way most people view them. The only sort of exception to that, or not exactly an exception, the only follow-on from that is sometimes when an abusive relationship ends, it leaves a huge hole in the person's life. And it is literally a hole. It is a hole made by a nasty thing, but it's still a big gap in the person's life. And that hole still has to be filled, because previously they're spending a lot of time in thinking and acting in relation to this abusive relationship. And when that's no longer there, there really is a big hole left. Has to be filled.
Now there's a lot of love for pets as well.
Yes, yeah, well, fair enough.
But Rebecca, who hasn't got room for pets, has been growing a lot more herbs and flowers, potted plants, and she's really enjoyed that. So it's nice.
Yes. Lovely, yeah. Okay. So develop your relationships in a best way that suits you. Pay attention to intimate relationships. Pets can be great. And back we go. My word, our hour, we better get on, my word. Environment, here we go. Now this strange photograph there is a saying, you might know it, that if you're a tulip accidentally planted in a rose garden, you shouldn't spend your time trying to be a rose. You should still be a tulip. You should be what you are. So let's have a look. Think about this. I think the environmental factors are, in a way, I think they're the most underrated, because they can have huge, really quick, instant effects. So let's just have a look. Find an environment in which you flourish. So tulip needs to go, I don't know, do you have tulip gardens? Whatever. Wherever tulips belong, that's where the tulip needs to go to. But the patient that I really remember on this one, because again, it's always the first one you come across in a particular area. He was a wonderful guy. He'd come to us. It was a secure setting I was working in. And he'd come to us and he had a whole host of fire setting, arson offences behind him. He'd spent most of his life in secure settings. He'd been brought up in children's home and foster homes. He'd got in lots of fights. He'd done lots of dishonesty offences, and he'd been mostly locked up. And he was 30 years old by the time I saw him. And his file was just so thick. And I was, to be honest, I was had a bit of a loss, because everything he'd been very good places. He'd tried all sorts of good things with him. And I said to him, well, supposing we could just make a fresh start, and supposing we had a blank sheet of paper, what would you write on it? And he said, quick as a flash, he said, I'd love to be a gardener. Oh, it's not meant to link with the roses and tulips, but he said, no, I'd love to be a gardener. I said, oh, right, because instantly I thought, well, it's all very well, but you're in a locked facility, you can't. And I said, well, what else? He said, well, I'd love to have a bike and ride around on a bike. Well, same thing applies to that. I said, what else? He said, well, I'd love to learn to play chess. I thought, oh, that's good. In a locked facility, you can easily learn to play chess. And I couldn't understand why I had not done that before. And anyway, we had these good three things down on paper. And after a bit, we got him out on license into the grounds, not out of the hospital, but into the grounds to work voluntarily with the garden. They had half a dozen gardeners, professional gardeners, and he worked with them on a voluntary basis in the gardening team. And he did really well. And he's really knowledgeable. He wasn't just winding me up that he wanted to be out and about. He did really well. He's very knowledgeable about gardening. And after he'd done that for about 6 months, the gardener felt able to give him a reference. And he applied for a gardening job with the local authority. And we got him licensed to be able to do that. And off he went on his bike to his job with the local authority in the gardens department. And I followed him up for literally years, and he really flourished. And I find it absolutely fascinating, because I thought, well, how, well, I was looking through his notes, the previous great big bundle of notes he had. And in there was not a single mention of gardening or bicycles. I thought, isn't that fascinating? Because if you take a problem-centered approach, of course, you do focus on fire setting, and there's all sorts of interesting problems he had. And but he found an environment in which he really, literally flourished, absolutely flourished. And I think it's a fascinating question to ask yourself and to ask your patients. In what way could your environment be changed which would help you to flourish as the person you truly are? It's a good one to...
It's particularly interesting now at COVID if you're working from home, because your haven can become hell if it's not set up for work from home and it's simply not you.
Absolutely, absolutely. And I think it's a very good point too, because it's very easy to think of grand environments like becoming a gardener rather than something else. But no, the details of how you set things up at home, I think, is really important. Just that aspect of the environment, very much so, yeah.
Jenny's sharing that that story, showing how an open-ended question can reveal so much and change the way of doing things.
Yes, yes, yes. Yeah. I mean, it's interesting, isn't it? As professionals, we do lots of things right and we do lots of things wrong. I think it's very interesting to ponder when you've done something right, to just how, what are the lessons from that? And yes, an open-ended question like that. Start your life from now. What would you do? Yeah. Now, people have looked, I mean, just going back to the comment you had there before last, Ames, the visual and physical environment at home or wherever you are, at work or wherever you are. 3 things, probably in this order. It has to be safe, it has to be attractive, it has to have positive meanings for you. So traditionally, at home or wherever, we try and get sharp corners, eradicated, removed, softened off. No sharp corners about a place, no dangerous things or things that look as though they might be dangerous even, because that has a sort of deep down effect on us. Equally, we love things to look attractive. To our eye, it needs to be attractive. It just has a good effect on us. And a positive meaning to us could be anything. Could be photographs of loved ones or loved cars or whatever you like. It can be anything. And if we can tick off those 3, then we're doing quite well. But then there's the auditory environment, the idea of listening to sounds that have a good effect on us. I'm stuck because I was brought up with Radio 4. My parents, when I was 5, 6, whatever, it's always Radio 4. So it's a kind of homely effect to Radio 4. But now, in the morning times, if you listen to Radio 4, it's relentlessly depressing, one depressing thing after another. So I'm stuck. Do I move away from Radio 4 and move away from, that kind of niceness? Or do I move, or do I stick with this wretched one bad thing after another? So the auditory environment is important. But music, and we talked last week about having a playlist which is, which has a good effect on us. Yeah, a whole load of tracks that have a good effect on us. Somebody asked a very good question last week, Ames, and I didn't answer it well enough. It was a question that they said, well, what is that effect? Is that memories or what? And of course, the answer is it could be anything. It's a neural circuit. So it will transcend memories. It goes wherever it wants to. The neural circuit can transcend not just a memory bit, it can go into all sorts of parts of the brain. It really is. It transcends everything. So the question to ask ourselves is not, does this music spark off good memory, but does this music have a good effect on me? And if it does, even if you can't fathom out why, it's put it in the list, put it in the playlist of music that has a good effect on me. So sounds, auditory and TV even that has a good effect. Lovely stuff.
Kathy swapped to Classic FM, and that's much more conducive to mental well-being, apparently. Maureen's learned a musical instrument, and that's the best thing she's done in lockdown.
Gosh.
So music is striking a chord.
Very good, very good.
Yeah, I didn't mean to do that.
Yeah, right. So there we are, the environment. It really is so easy and so deep-seated. If you can change the environment, it really affects the brain deep down. Environment in which you flourish, mold your physical environment in a way that has a good effect on you, and a good auditory environment. So, all done?
All done. Beth's just given us a top tip that Spotify generates automatic playlists based on your most listened to tracks. And so often they are your favorites.
Yes. But sometimes people have favorites that don't actually have a good effect on them. It's very strange. So if you can just spot the ones that really have a good effect on you, you can have that as a playlist. And as she says, Spotify will suggest new additions to that playlist. It'll look at it playlist by playlist and suggest new additions to each one. Lovely. The other thing is that, of course, some tracks, they will have a good effect on you for a while, and then the effect wears off, in which case, drop them from the playlist and put something else in. Okay, I think we're just about going to scrape in, aren't we?
I think so. You've just popped us into this subject without any voting. Are we all right?
I think that's the only one left.
Oh, okay.
That's all, except for the Q&A.
And yeah, super.
If your game, Ames, I think we're probably going to get this nicely done by the hour mark.
Super.
And then we can go to Q&As, and perhaps if anybody wants to go, can go, and anyone who wants to ask Q&As can have it, and you can take the questions and ask me or whatever.
Yeah, I'm happy.
Is that okay?
Yeah, super.
Now, the people sometimes say, well, what do you do for people for whom you can't do anything? And it is, as though it sounds like a riddle, it's a very good question, actually. And the original, when we had a meeting of tutors, and this question originally came up, people said, yes, what do you do for people you can't do anything for? People, for example, who have panic attacks, because panic attacks are really very, very difficult to treat. And people who don't have panic attacks think it must be incredibly easy and simple, but people who do have them, it's really difficult. Or some psychotic conditions, or indeed any condition, intractable depression or anxiety. Yeah, anything for which you can't actually sort it out. The person has been to really good people, and it turns out to be uncurable. A very good concept came up from service users, actually. It was from people mainly with psychotic episodes. And they had this concept, is about recovering a good quality of life, even if you can't literally recover from your condition. And that has really transformed life for lots and lots and lots of people. Rather than spending their entire life plugging away at trying to cure their psychosis or whatever the condition is, then they've said, never mind that. We've given that a good shot. Let's just recover a good quality of life. And of course, that in turn has a good effect on whatever the problem is. So that is just such a good idea. And you probably know examples. I can tell you one example if you like. And that's about someone who indeed does have very, very bad panic attacks, to be fair. And yet they've recovered a quality of life that most people would give their right arm for, to be honest. They've got a fantastic, fantastic job, fantastic friends, and just really got themselves in an environment that suits them really, really well, and have recovered a quality of life which is fantastic, I would describe it as. So we don't want to get too hooked on the idea that to recover a good quality of life, you have to literally recover from whatever was the underlying condition. If it's intractable, then so be it. Just go for recovering a good quality of life. Okay, all right.
Somebody's worried that we haven't done one of the modules, responding to distress.
That was the very first one we did, actually.
Was it? Oh, good.
Not today, but
Last time.
Last time out, yeah. If you remember, we had the meditation being so good, and Mark Williams. If you go on if you search for Mark Williams Penguin or Penguin Random House, the publisher, you get some fantastic meditations there. And
it's all coming back now.
Oh yeah, distraction. There we are.
I hope that's okay, Yinka, if you remember that one. And actually, I think now, aren't they, Will? Is last week's available on recording on the website?
Oh, it is, yes. Yeah. And so will this one be?
Yeah. So yeah, if anyone needs it, its website is www.apt.ac.
Lovely. Well, there we are. We can have live Q&A, but its hour is up. So I'm very happy to stay for a few more minutes. I think Amy said she was happy to stay for a few more minutes. So if you've got any questions, do slap them into, chat, and we'll see what we can do. Otherwise, thanks ever so much for coming. It's lovely to see so many people turn out again. And we only advertised it 48 hours ago. So really well done spotting, and thank you so much for coming.
There's been some lovely thanks and comments in chat. So thank you, everybody. It means so much to see the lovely comments. So thank you.
Lovely.
Stephanie and Versha, you've got your hands up. So if you wanted to pop a comment into chat, we'll be able to see it there. Veronica has told us that Chinese medicine starts with looking at the tongue before anything else.
Yes, yes. No, the Chinese, they pay fantastic attention to the digestive tract, from the tongue right through the digestive system. And increasingly, there's two very good books, one called Gut by a German doctor, and one called Clever Guts by a British doctor, which really look at the whole digestive system very nicely from tongue downwards. And yeah, absolutely, it's increasing emphasis on that.
And we're just getting lovely comments, no questions. So I think you must have covered everything well.
Oh, well, fantastic. Lovely.
Yeah.
Yeah. This is out of date, this Christmas tree one, isn't it?
I know. Perhaps you're looking forward to next Christmas.
Right, okay. So what should we do? Should we just go then?
Well, shall I put some music on and we'll read your chat? So thanks, everybody. Lovely to see you. And we're on again next week, aren't we? You're doing a slightly different...
We are, yes, we should perhaps. Yeah. Yeah. The whole program is up and running on the web. Actually, the people can actually read what's happening on the website, apt.ac. Put in free, search for free, and it'll show you what's there.
Sounds good.
Okay, well, thanks for coming, and hopefully see you next week or the week after or the week after that. And in the meantime, keep well. Thanks, Ames.
See you all soon. Bye.
Bye.